And Dr. Bowman didn't ask about the thermometer test, but that's one
Yeah.
of the questions that I've received so many calls about in
Mm,
the last 2 weeks. Mary Beth Kirkpatrick, even with Impact 360, she's an
mhm.
awesome orthodontic consultant
Yeah.
with a depth of knowledge about the profession. She called me from one of her clients' offices this week and said, Jackie, how much longer are we going to have to continue testing these employees and patients? It's really impacting the schedule.
Yeah.
Well, a CDC for a number of years has recommended testing patients to see if they have a fever. And if
Mm,
so, then that indicates they're infected with something. It may not
mm,
be
mm.
COVID-19, but it
Okay.
could be that maybe they're going to break out with measles. Maybe, their parent doesn't believe in vaccinations,
Mm.
or they fell behind on getting their vaccinations
Yeah.
during the pandemic where they weren't going to the office as much.
Right.
And so for those diseases, I think, if anybody who has a fever, and as CDC says, above 100 degrees, then we should reschedule them. Now, Mary Beth at the same time says, but Jackie, for the past year, this office has been doing those tests and they've only had 2 patients come in that had a fever. I think one of the lapses with these touch-free thermometers is that we
Mhm.
haven't calibrated them. Everybody goes in and you get the tested and test at your temple, not at the
Yeah.
center of the forehead with it, or possibly at the wrist with it. And it
Uh-huh.
comes back 96.7. You're normal, good to go. Well, we know that the human at normal temperature is 98.6, correct?
Right. Yes.
So why didn't this device measure 98.6? Why did it measure 96.7 or 97.8?
Okay.
So it's not measuring accurately, and there's a variable about how close or far away do I
Mhm.
have it. So it needs to be calibrated. And an easy way to calibrate it in the office is to take a old-fashioned in-the-mouth thermometer and
Okay.
take say an employee's temperature with it.
Hmm.
And they're 98.6. Well, then what is the temperature with this?
Okay.
Oh, 97.6. So we know that we need to add 1 degree to
Hmm.
calibrate this with what is the standard, correct?
Okay.
So if we're testing patients and they come in with a temperature of 98, they may have truly had a fever of 99.6
Hmm.
that we were not allowing for with calibration on the touch-free thermometer. So I
Hmm.
would recommend to offices to calibrate their thermometer, know what they need to add to be at the normal temperature, and they might discover that they have more patients coming in that do have a fever that they've been missing. And again, it's not just because of COVID-19. They could have one of those other infectious diseases.
Yeah.
So patient symptoms, treating patients who are ill. I think that's going to be an ongoing concern, is
Hmm.
how we review the patient's status at that time as they come in for
Yeah.
appointments. And I'm real hopeful that all of those computer software companies and hardware companies that are out there come up with a symptom or an application, I should say, that as patients log in for I'm here, ready for my
Uh-huh.
appointment, it asks them, do you have any symptoms? And it has a built-in thermometer that is
Wow.
calibrated and
Hmm.
automatically says, temperature normal, you're good to go.